In April this year, the Georgetown Public Hospital Corporation restarted corneal transplants after a 2-year hiatus. A corneal transplant is a surgery that involves replacing the clear tissue at the front of the eye with similar tissue from someone else. This is usually done when that clear tissue, known as the cornea of the eye, becomes infected. For this surgery to happen in Guyana, however, corneas need to be sourced in other countries, typically from deceased people, and shipped to Guyana where the ophthalmology team would conduct the procedure. With the human tissue transplant legislation that is currently in the works, the process of providing the surgery to patients, thereby allowing them to see better, or even at all, would be expedited. And Head of the Department of Ophthalmology, Dr. Shailendra Sugrim, said that his department is eagerly awaiting this.
Corneal transplant, even though there's a legislation being tabled for organ transplant, when we do corneal transplant, it's not an entire organ. It's actually tissue transplant, right? So it's a part of the eye, the front or the anterior part of the eye that we transplant. And because of that, it doesn't require genetic testing or any sort of compatibility testing, especially because the cornea is avascular. And there's not a lot of detail that needs to get into compatibility or to have the tissues used on a patient. And because of that, the corneal transplant legislation will fall in a minor subsection of the entire organ transplant issue, because we don't have much of an issue with it. But going forward, we look forward to when the legislation will be passed so that we can eventually pave the way towards having our own eye bank, so where we can harvest the corneas in Guyana and we can have the tissue readily available for transplant.
Local ophthalmologist Dr. Celeste Hines, who has been involved in corneal transplants, is also eagerly awaiting this.
As soon as the legislature is passed, we'll be able to put more systems in place where we can actually have Guyanese donate local corneas. I mean, there's nothing better than local. So yes, we're hoping to get to that process where we will be able to harvest and donate our own corneas. So we have them readily available. We don't have to wait for that shipping process to actually get corneas in Guyana.
This human tissue transplant legislation is expected to be presented to the National Assembly soon. Reporting for the newsroom, I am Vishani Ragabir.